So we're talking this week on Dollars and Cents about some of the other things that you might want to consider as you're approaching retirement, or if you're in retirement. Things that, according to some of the most recent surveys and data out there, suggest are far more important than just having an understanding of the financials. Don't get me wrong on what we're talking about. The financials and understanding your investments and your income in retirement will always be of the utmost importance, because after all, you can't really retire if you don't have the numbers and the money to do so. But what's a lot of the surveys are showing involving recent retirees is sort of a lost identity, a kind of a lost social interaction, concerns over what they're going to do, and all of that leads to a multitude of other issues. So on this week's program here on Dollars and Cents, I'm joined on the program today with fellow certified financial fiduciary, also a National Social Security advisor, Rob Field, part of the team at Nelson Financial Planning. We've been together, you've been on the team for what, almost a decade?
Coming up on 10 years.
Coming up on 10 years. Well, that is fantastic. Next year, I myself will hit my 25th year here at Nelson Financial Planning. And as a firm, and you're going to hear a lot more about this in...
Drum roll.
Yes, drum roll. I think one of these buttons on that board does the drum roll thing. It's like a rim. Here we go. There we go. There's the rim shot. 40th anniversary of Nelson Financial Planning next year. We're going to be talking a lot more about that. But this week on the program, we're talking about sort of what I've coined as the tri-life crisis. And that simply recognizes that when you're retiring at 65, you got a pretty good shot at living another 25-ish years. So you still have a third of your life left to do. What does that look like, and what do you want to do about that? Because for a lot of modern retirees, it really is sort of reimagining what your life could be in that sort of last third of your life. And certainly it's some pretty interesting data and statistics and exercises that I think folks close to retirement, Rob, can certainly engage in.
Right. I think what we're starting to see here, kind of the theme, is that although finances aren't the most important part of retirement, a lot of these things we talk about, being social, getting out, traveling, being with family, does require your finances to be in place. So we certainly want to make sure that we touch upon that. But what makes retirement successful, what makes retirees happy, is really not the money part. It's the social, staying healthy. With modern medicine, they're going to be living longer and longer, and that's why we don't view retirement as like, oh, it's that last little twilight. It's actually another third of your life. And so, we're going to talk a little bit about, how do you address the health and wellness, and then later on we're going to talk a little bit about your legacy and how do you want to be remembered. So, we know that it's an important factor of retirement is to stay healthy, because if you got a huge amount of retirement saved, but you can't get around, you're going to be miserable. So, statistically, people are living longer. General health, the U.S. population can be improving. Again, we've got a great medical system. So thanks to this modern medicine and then more information we have on healthcare, obviously the internet is providing people with all kinds of things to learn about how to live a healthier life. You're going to spend more years than you used to in what I would call post-work activities, things you're going to truly do in retirement. And how healthy you are will determine what you can do.
Yeah, no question. It goes, and I guess just really the point of this week's program is to really talk about the importance of the quality of that retirement, and quality meaning more than just having my financial house in order, but what does that social aspect look like? You mentioned early in the program that exercise, and I would really encourage everybody who's close to retirement or at retirement to do this exercise. Write down. Take a moment, get a sheet of paper, get a pencil, write down the 5 things that are most important to you and the 5 things that are least important, those things that are most meaningful, those things that are least fulfilling. That will help guide you as to what you're going to do from more of a social perspective. But certainly, Rob, as you're talking about in this segment, that health is pretty important, because if you're going to have another third to go of life, then you want to make sure you're in decent health to be able to enjoy that. So that gets into all of those other things about, eating right and exercising and sleeping and good mental health and all of those kinds of things that you want to make sure that you're working on along the way to have that quality retirement.
Well, certainly. I mean, we want the bottom line to be, living longer, and so thus let's improve the quality of your life as you're going along. You mentioned a variety of things. There's 3 topics we're going to talk about over the next segment or so, and that's going to be the mental, physical health, how to manage your health care, and then how to address unexpected medical costs. Some of those items you just mentioned, eating, people don't realize this, but, most people when you're working, get up, quick little breakfast, you head to work, eat lunch around the same time. Usually you're bringing your lunch. You come home, you eat dinner around the same time. It's a cycle that goes around and around and around. When you are not working, you can skip breakfast or eat a big breakfast or have a light lunch or go meet people for dinner or go out to dinner or start cooking more. The exercise portion, very important. A lot of people find that it's harder to exercise when they retire because they have too much time and to try to figure it out. When you're working, you get home, it's like great time to work out, or you get up early, great time to work out. When you can make your own schedule, sometimes exercise drops.
So important, that routine. And I guess, Rob, to your point, when you're working, you've got the routine, and that's the routine, and that's what you're doing. We've got a client who's been retired for a number of years now, and he really leaned into being more active and exercising. And, I was just talking with him just this past week, and he told me he had just turned 60, and he had just competed in a highly elite cycling event. And he was the first place American, and this wasn't like a senior event. This was a event with folks of all ages. So it can be done, and it's great to hear those stories that our clients share with us about what they are doing to stay healthy. That is for sure. Now, you mentioned the next topic or the next piece of this health and wellness is really more about, of course, managing your healthcare plan and your health insurance and how all of that plays out. So I guess that gets us into a little bit of a conversation about Medicare then.
Sure, because as you transition from work, where you probably got your medical insurance, over to retirement, you may or may not have access to that insurance. Obviously, Medicare is kind of a big topic because everybody qualifies for it at age 65. So we really, that's kind of that magic number you and I always talk about.
Sure.
With clients and prospects is 65, because before 65, Medicare would not be available. And so at that point, you're going to have to pay for some insurance out of your own pocket. Typically, medical insurance for husband and a wife is in the $1,000 range. People don't realize that because sometimes the company's paying the majority of their medical premium. Certainly, you could look at COBRA. If you left your company and they offered you to keep that medical insurance, still going to be a lot more expensive than what you were using before. Certainly, you don't want to self-insure. That's a gamble that
Right.
As you start getting into your 60s and 70s, you're going to have medical costs. You don't want to just pay that all out of your pocket. But at 65, once you hit 65, you're available for Medicare. You've already been paying taxes in. So Part A, which is what we call the hospitalization, you've already paid for that. You already get it. So you should certainly go online, get your Medicare card, and have that. Part B is required by Medicare that you have some type of coverage for Part B, which is basically the doctor side. So if you were under 65 and working, you could certainly, or even if you were 66 and 67 and still working, you could still use the medical insurance at work. But if it's 65, you're not working, you've got to pay for the Part B. It's about $170 a month, and that kind of gives you your normal Medicare setup. Part A for hospital, Part B for the doctor. If prescription drugs becomes an issue, that can be expensive. Medicare doesn't cover that directly, but there are supplemental plans that affect what we call Part D. And of course, there's Medicare Advantage plans. It takes A, B, and D and combines it all together. It's something you should research, and obviously something we'd be glad to advise on.
And certainly, that age 65, and whether you're before it or after it, that's pretty crucial, because the 65 is Medicare, which is different than some of the ages for full retirement under Social Security. Well, we're going to talk more about that piece, but we got to take a break and get some messages in here. So stay tuned for the last segment of Dollars and Cents with Joel Garris and Rob Field of Nelson Financial Planning.